Hello, everybody, and welcome to another episode of Let's Talk About. This is me, Amin.
And this Alex.
And in this episode, we're going to continue on our ongoing coverage of the COVID-19 situation right here in Malaysia. So why are we doing that? Because we've been covering COVID stuff on LTA for maybe 3 or 4 episodes already, and Alex also has like a weekly update show where he shares COVID-19 updates in Malaysia, related to Malaysia, and we're seeing like a lot of views. We're seeing a lot of attractions. You guys really like that show, really like this show, and also you guys ask a lot of questions and put in a lot of comments. You share your experiences, you share your questions, you share your concerns, you share a lot of things, and that really motivated us to continue to supply legit information, fact-based information, and fact-check information with regards to COVID-19. So in today's show, we're going to address some of the misconceptions and some of the questions that people might have, that people do have about COVID-19. Of course, we're not going to address basic questions like, oh, should I get vaccinated, or what are the SOPs? No, it's more of the like underlying questions, or really serious questions that people are asking, but they're not getting answers to. And also questions that make you think. And also we're going to also address, things that are flat out myths and lies about COVID-19. Why are we doing this? Because it helps you guys. And number two, if you guys watch this show or listen to this show on podcasts and you find it informative, what we ask from you is you share the knowledge, because that's really important. We're doing our part to help spread the knowledge so that more and more people are more informed about COVID-19. They're more informed about the vaccination. They're more informed about how to get vaccination. They're more informed about how to get protected, so that we can keep each other safe. We can keep the numbers down, and we can start going back to normalcy sooner. That is my request. Spread the knowledge, spread the information, and make sure everybody's safe. All right? Okay, so before we start, I think I want to ask a question. I forgot what was the question I wanted to ask you.
Is COVID created in a lab?
Yeah, okay, let's address that thing, right? So now there's some theories surfacing stating that the COVID vaccine is created in a lab. And
definitely it's created in a lab, but
COVID... not the vaccine. I mean the virus. Okay, why are we asking this question? So we were covering some news, and I found something interesting on Soy Chinchao the other day. Facebook, which is like a good kind of like indicator of what's going on in the world, right, has stopped hiding, or has stopped censoring. I don't want to use that word, but yeah, they have stopped censoring postings that claim that the COVID-19 virus was created in a lab. And the reason why they did that was because America, under the presidency of Joe Biden, has restarted investigations. Not restarted, has like kind of like pushed investigations to explore whether the COVID-19 virus was created in a lab. Now the question is, so Facebook has stopped censoring, spreading the information that COVID-19 is created in labs. The US has now pushed for harder investigation on whether China tried to hide this notion that COVID-19 it was created in the lab. So what are experts saying? Is it created in the lab? So what do you think?
I think since this has been investigated since the start of the pandemic in 2020, and a lot of experts have found out that is impossible or unlikely that's created in the lab, and it's actually come from original sources, like from transmission from animals and all that stuff. Yeah. And the reason why, to go back to the Facebook thing, the reason why they stopped censoring or at least suppressing that kind of news is because Joe Biden has sort of relaunched the investigation, and they need to get back to him in 90 days. So there's two ways to look at it. One way is America's being, is US being more suspicious or trying to push agenda that China's behind it, or another way is they're trying to be very sure that let's eliminate that this is indeed coming from a lab.
Yep.
So there's just two possibilities
Yeah,
here.
I guess that's a good perspective, right? So
Yep.
it's like, okay, let's just kill this
Once and for
theory
all.
once and for all. Just go and investigate. If it is, okay, it is. If it's not, then just stop talking about it so
Yeah.
that we can focus on recovering. I think
Yep.
that's a good idea. The other thing is like, okay, a lot of people saying, yeah, of course, like, there's one camp saying, of course, it's created in a lab. You know, China is very sketchy. They are good at covering up information and stuff like that. Here's the thing: all countries are doing that. Even even the US is doing that. Russia is doing that. All countries are covering something up. All countries are doing something that they don't want people to know.
Of course, everyone has done something shameful, right?
So you can't just single out China. I don't think China is especially terrible at doing. I mean, I don't think China is exceptional in terms of covering things up. Yes, they are doing things that are weird. Even Myanmar is covering stuff up with the Rohingya things, you know. So I don't think you should blame the country. So whether it is being created in a lab or not, we've been doing the reading, we've been doing the research. So a lot of experts are saying, even the WHO, people who are behind the theory that, you know, the pandemic is from natural causes, are still adamant and are still holding the line and saying that, you know, it is from natural causes, and most likely it is from a bat that has bitten like an animal that has a virus, and that virus was able to then was able to then jump to a human host, and from then, you know, history happened, and we're here in this situation. So I cannot say that the jury is out. So if people are saying, if you're at your dinner and you're at wherever you are, and people are saying this, right, it's created in a lab, I want to be careful with the words I'm using. I don't want to say that it's still up in the air, because it's not. People are investigating, because like Alex said, they want to reduce the likelihood of it being true. And if it's not true, not reduce it, like eliminate that possibility altogether so that we can focus on other things. And experts are saying that it is very likely a natural cause, originated from natural causes. And why do they say that? It's based on history. It's based on 100 years of history and research and knowledge and facts. And I guess from back then until now, no that deadly pathogens has come out from a lab. You know, so I guess we can safely say that it's very unlikely that it comes from a lab, because the theory was a careless lab worker did something and accidentally released the COVID-19 virus to the world.
Yeah, and
that could be a movie lah.
yeah, but also, of course, another thing is it could be a political agenda, but also another reason why they say this lightly, that's what they speculate, is because the location of the lab is very near to the market where it all started. So it looks like a very nice setup.
Yeah.
Yeah, but of course, until it's proven, you know, we can't say it is from the lab.
Like I said lah, you know, it's like a movie lah. So the American administration are very careful. They're not saying that, you know, it's done for nefarious reasons. They're not saying that it's done for an experimentation. The hypothesis is a careless lab worker accidentally, you know, let the virus escape. But as you know, laboratories in the States and also in China have protocol, and they do handle very dangerous levels of pathogens, viruses and bacteria and stuff like that. And they do have protocols. Okay, granted, one of the other situations is the level of safety that's available that is required in the US to handle very dangerous viruses is higher than in China. There are a lot of redundancies already built into these safety mechanisms. That is more of like, you know, it's more of like, okay, it's more of deciding like, okay, China feels that this is safe and the US feels that they have to do it like this. It's not like, okay, China has to follow the US or the US have to follow China. It's more of standards. And it's not saying that the US has a higher standard and China has a lower standards. That ranking is just like that. And both, I think, are very aware of the risk of handling very dangerous viruses, and they are stored safely in labs. And that's all I can say. I hope we've answered that question. If you have any more questions related to that, or your concerns or your opinions on whether COVID-19 was created in the lab, put them in the comments section below. What about Sinovac halal? What about Sinovac? Is it halal?
Well,
Yeah.
okay, I think this.
First of all, why do people think that Sinovac is not halal?
I think this all stems from the Hajj requirement, because when people want to go for the pilgrimage in Saudi Arabia, it's reported that they only accept people who are vaccinated with Pfizer and AstraZeneca. So people are concerned that what's going on? Why is Sinovac not on the list?
Is that true though? They only accept people with those vaccines?
Yeah, it's true. They only accept Pfizer and AstraZeneca for now.
Okay.
And Malaysia is aware of that, and they are actually having talks with the Saudi government to allow some leeway for those who have received Sinovac.
Okay.
And if you think about it, right, all vaccines, especially in Malaysia, they're all deemed as harus. And you know who's a large user of Sinovac? Indonesia. In fact, the president of Indonesia also takes Sinovac vaccine, and they said that Sinovac is halal and aman and safe to use. So you think about it, right? Would Saudi Arabia accept Sinovac? I would say eventually they would, because you can't ignore the largest populous Muslim country in the world, which is Indonesia, which are using Sinovac vaccines. So I think it's just a matter of time.
And I don't think the reason why Saudi Arabia is not accepting people coming, or Saudi Arabia put out the requirement only people with AstraZeneca and Pfizer are allowed to enter the country, right? Not go for Hajj, right? Specifically enter the country.
It's for Hajj. This requirement.
Okay, so for Hajj, right? Even for that, I don't think it's because it's halal or haram.
I got a feeling maybe it's more.
Se.
I would say probably it's more on health regulation, because maybe they are administering those vaccines, so they're confident that, okay, we're using these vaccines, we approve them, that's why we recognize them for now.
Yeah. I think that's the reason. Because okay, I'm a Muslim. It doesn't mean that if I have ingested something that is haram, I'm not allowed to go to Hajj. It doesn't mean that. That's between me and God, and it's not up to a country, it's not up to a people or whatever. So I think the reason why Alex said is, they feel that Astra and Pfizer is safer or more efficient, or not more efficient, but more effective. And that's the reason why. And probably they're just, waiting for more results, more tests to come
data.
in. Yep. Before they say, okay, these vaccines are accepted. And you've rightly pointed out, Indonesia is one of the most populous Muslim countries in the world, next to, I think, China, if I'm not mistaken. And they're taking Sinovac. So it's not an issue. I think we need to lay this concern of whether vaccines are halal or haram to rest, because again, I'm a Muslim, and when it comes to being a Muslim, right, and Islam is very nice and easy. It's very simple. If it's medicine, if it's ubat, and if it's something that's going to make you better, and if the sources are from things that are not halal, let's say if it's from a pig or a dog or whatever, you are allowed to use that, because you're not eating it. You're not ingesting it for pleasure or for gratification or whatever. You're doing it because you have to, and you do not have a choice. Okay, granted, there's another school that says, okay, yes, that's true to a certain degree, to a point where, okay, if there is a halal alternative, then you take the halal alternative. Yes, I agree. But at the moment, we do not have the choice to choose. We don't have the option to choose. So, again, back to Islam being simple and easy. If we do not have the option to choose, and if it's for the betterment of the society, right? Take whatever vaccine that's available for you.
And we're in emergency right now, Darurat, right?
Yeah, take whatever vaccine that's available for you. In Islam, it's called this fardu kifayah, right? So you're doing something good for the community. So taking a vaccine, whether it's Sinovac, CanSino Bio, AstraZeneca, Pfizer, Sputnik, whatever, you take it. Because if you are a good Muslim, you want to put in your heart that I am doing this for the greater good of the community and for myself, right? Then it's done. It doesn't matter. God is not going to be so menial to say, oh, it's from a pig, I'm not going to accept you. Whatever you do is terrible. It doesn't work like that, guys. So, I hope I'm not touching on a sensitive subject with regards to religion, but, that's what I believe anyway. I mean, religion is simple. It's not just Islam. It's a lot of religions are simple. And if you don't overcomplicate it with all these things, you'll be a happy person. So, there you go. Okay, let's go next. Okay, there are claims that thousands of people have died because of not COVID, but the vaccine.
Yeah.
Is it true?
That's because the conspiracy theories that we've seen online, especially on Facebook and WhatsApp and all that. There's a lot of conspiracy theories point out that the vaccines are dangerous. They're killing thousands, maybe millions of people right now, and
Maybe millions.
yeah, that's what they always make this such a big claim. And most of them they point it to this platform called VAERS. So VAERS is actually like a platform for doctors and medical professionals to report on vaccine adverse effects.
Okay, so VAERS is first of all, I just want to clarify. VAERS is an acronym. It's spelled VAERS, and it stands for Vaccine Adverse Event Reporting System.
Yeah, from the US.
And it's used for
reporting reporting any deaths or adverse effects following vaccination. So it could be anything because, like for example, you get a vaccine, you choke into something, and then something bad happened. That's reported as well.
Oh, really?
Yeah, I mean anything can happen.
So if I take a vaccine, okay, touch wood. Okay, if somebody takes a vaccine and then dies in a car crash,
or anything,
they have to report into the system?
Car crash, I'm not too sure, but let's say any medical condition, they report it. But this report doesn't mean that it's caused by the vaccine. And it's very clearly mentioned on the website that this is a voluntary reporting system which is used by healthcare workers. And they will put a disclaimer out there that the reports on the site may contain information that are incomplete, inaccurate, coincidental, or unverifiable. In large part, reports to VAERS are voluntary, which means that these are subject to biases, as said very clearly. And this creates specific limitations on how the data can be used scientifically. Data from VAERS reports should always be interpreted with these limitations in mind. So like we always say before, right? Correlation is not causation.
Yep.
Yeah. So as of now, like in Malaysia itself, right, there are no deaths that are linked to the vaccine. But we are very sure that there are a lot of deaths that's caused by COVID. So which is more serious?
Directly caused by COVID.
Yeah.
Not because like somebody got COVID and got into a car crash and died. No.
Yeah.
It's like related to directly caused by COVID.
Yeah. Since we mentioned that, right, not all deaths involving COVID positive people are considered as COVID deaths. Because if let's say someone died in a suicide or car crash and later tested positive, they're not classified as COVID deaths because it must be investigated and confirmed that this person died due to COVID-19.
Yeah.
And the same goes with vaccine as well. Of course, you might see some reports saying, this guy got 1 or 2 doses of vaccine and he died. But he could be died from various reasons. It could be heart attack or other illnesses or like a car crash. But you cannot blame it on the vaccine. And the other people claims that, there's a lot of deaths, but they're not reporting it. Like, there's this thing on WhatsApp. Apparently, there's an audio message by the name of Makte. They're circling around. They're saying, some people died of vaccine and they are ordered to cover up by the health authorities. Come on. Death is so hard to cover, man.
How do you
cover death?
Yeah, how do you like hide a death?
Yeah.
Like, how do you do that?
Yeah, and then that Makte WhatsApp audio message claimed that a lot of nurses or doctors were dead. If that's true, right, that hospital's gonna be shut down, man. We're gonna be lacking our staff. You're gonna realize, hey, what happened to this person? It's not here anymore.
Yeah, I don't know, man. When you start hearing all these conspiracy theories about a lot of people have died, but it's been covered up because it's a whole system. Here's the thing. It's not easy to keep a secret.
Yeah.
It's not easy to keep a secret at a small scale. And you think it's easy to keep a secret at a large scale, it's almost impossible.
Look at our society right now. If something happened in the streets or supermarket, right?
Yeah.
What's the first thing happen? People take photos,
Social
take
media,
videos.
viral.
Take photo, take videos, spread it. You can't hide it anymore.
Yeah. So, I don't know. If you see any conspiracy theories or all these weird claims on your makcik's Facebook or your family group, WhatsApp, drop them in the comments. Maybe we'll help debunk them. Maybe we'll put them in the show, next, like the most ridiculous COVID-19 claims. And we'll put that in the show and maybe it'll help somebody.
And also, here's a tip. If you do receive this kind of messages from your auntie relative, right, ask them, where did they get information from?
Yes.
If it's on WhatsApp, most likely it's fake. And you can tell that certain videos or messages, they will say forwarded many, many times.
Yes.
You ask them, where does it happen? Is there any proof that this happened? Who's the name of the person who made the claim?
Yes.
Like Makte.
Mate, huh?
Mate. Who is she?
Mate.
Yeah. How?
Everybody knows a mate.
Yeah. So, this kind of thing, like question, where did you get the source? If you can't prove it, then it's not real. Because if it's real, all the media is going to report it.
Yeah. I'm doing that in my family group. So I have like 2 family groups. One is from my mom's side, one is from my dad's side. So I'm in both groups, and I get a lot of these weird messages. So I don't chat or whatever in those messages, but when I see all this weird stuff coming out, immediately
Amin arrives.
yeah, I'll put out like a I'll ask the questions. It's like, okay, where did you get this from? Is it true or not? And then it's like, if it's something I already see, immediately I'll say, this is not true. I'm sorry. You know, with respect, I have to say that this is not true. Please spread it. Please stop spreading it. Most of the time when we ask those questions, like, oh, I don't know, I just got it. I'm just sharing it here so that we all are careful.
Yep.
So that we all can be careful. So most of the time, the family members that spread this, from my experience, the intent is pure lah. The intent is like, oh, I want to tell my loved ones so that they are safe.
They'll be more careful, you know.
Yeah. But I don't know how to say it in English, but in Malay, niat tak menghalalkan cara. The intent does not does not validate the method.
Yeah, does not make it right.
Yes.
Yeah.
Yes. So please help be the police, the WhatsApp police, the fake news police in your family group. And, let's all together stop spreading the COVID-19 misconceptions. You mentioned also, Alex, there are like an injury scheme and stuff like that for people who are vaccinated, right?
Correct.
So it's like an insurance.
Yeah, so back to that point, right? A lot of people saying, oh, if you die, nothing's going to happen. If you die, it's your loss, loss of death. The thing is,
you take the vaccine, you die, you become poor. Your whole family is going to suffer, because it's a curse. But is it?
No, I mean, the thing is, like, number one, until today, there is no COVID-19 vaccine-related death. That's a fact. And number two is there is an injury scheme. So let's say if you get vaccinated and you suffer like adverse effect and it causes death or permanent disability, you can get a compensation of 500,000 ringgit. And if you need to be hospitalized for a long time because of the vaccine, they will give a compensation of 50,000 ringgit.
Wow.
So there's these measures in place to cover in case something bad happens. Because like we said before, there's always a risk in terms of vaccine, but the risks are low. But if it do happen to you, there's this plan in place to provide compensation. It's
like to put in confidence lah. Like this is how confident we are that this is what the government is saying. This is how confident we are that that the vaccination is safe. Even the Prime Minister has taken a vaccination. A lot of the ministers have taken vaccination. Now the media members are taking vaccination as well. They're running. Do you know what they're running?
Yeah,
what they're getting?
Not too sure.
Like
I think
probably like a mixture of like Astra.
Could be Sinovac or Pfizer.
Yeah, whatever that's available, they're getting it. And
Correct.
I don't think they can choose either.
Yep.
And this is what the government is saying. We are confident that people will be safe. People that the vaccinations are safe, and you won't get injured. But in the event that you do, we are willing to pay up to 500,000 ringgit if there's permanent disability caused by the vaccine or death. And if you have like a serious side effect that you have to be hospitalized for like, I don't know, prolonged means how long? 1 week? Did they say?
There's a breakdown, but I need to check that later.
Okay, so if there's if you have to be hospitalized for a long time, maybe a week or 3 or 4 days, I don't know, you get 50,000 ringgit payout. That's a lot.
Yeah, and then again, reminding again, there are no deaths due to the vaccine in Malaysia as of today, but COVID has killed 3,611 people as of Malaysians. And this week alone, the death rate is averaging at 88 people per day due to the COVID-19.
88 people today is high, guys. If you haven't watched our episode, when it comes to mentioning death numbers, it hits me lah. Because I read the news where a family lost both parents in a very short span of time because of COVID. So it hits me lah. So 88. It's easy to say that it's 88 is low. Or a lot of people seem to think because number is number. You cannot conceptualize the number. You cannot conceptualize the impact that one death has caused to the people that are close to that person that just died, right? So 88 deaths is high. It's higher than the daily deaths of road accidents in Malaysia. And as you know, road accidents is one of the top killers in the country. We are among the highest in terms of road accidents in the region. And it's serious, guys. So, you
want to make it more dramatic? It's like having a plane filled with 160 people died every 2 days.
Or
crash every 2 days.
2 bus loads a day. 2 bus loads of people disappear.
Yeah.
Die.
That's
a day.
Like that. Yeah, due to COVID.
2 bus loads of people. That's a lot.
That's a lot.
Okay, so stay safe, everybody. Take care of your parents. Take care of your, the old people, the people with non-communicable diseases and things like that. The high-risk people. Yep. Okay, so the next one. Are we guinea pigs taking the vaccines?
Of course not. I mean, all vaccines that have been released, they are all completed their phase 3 trials. This is a rigorous test. It's done, tested
What
on.
is this phase 3 trial?
So there's normally for new vaccines, there's like multiple levels of trials. There's phase 1, phase 2, phase 3. Phase 1 is second to test whether it's effective. Phase 2 whether it's safe, and phase 3 is to test on a larger group to test whether it's safe and effective at the same time. So this has tested, and based on that results, when they determine that the benefits outweigh the risks, then it's being authorized to use. And of course, all these vaccines have to be approved by every country's health regulators. Like in Malaysia, we have the National Pharmaceutical Regulatory Agency. So they look at the data. Once they're confident, they are satisfied, then it's authorized for use. So every country has that. Even in Europe, there's also the European Medicines Agency who looks through the data. So in the event if something is not right, they will pause, they'll study it, and determine whether it's safe or not.
Yep.
So all these are being done properly. And some people are asking why COVID-19 vaccines are developed so quickly compared to other vaccines.
Yeah.
Because number one, COVID is an unprecedented situation. It affects the whole world. Unlike other illness like Ebola, which is very regional.
Yeah, I wouldn't say it's unprecedented because we have the Spanish flu, which is like something that, is this not same scale. It was larger.
It was larger. And that's the difference.
Yes.
There was no
There was
vaccine
no vaccine.
for Spanish flu.
Yeah.
And that has a higher fatality
Yeah,
rate.
I guess it's unprecedented in modern times.
Yes.
That we have a virus that we have not known about.
Yep.
Yeah.
But the technology to develop the vaccines are not exactly new. They've been in decades of research. It just so happened that, when this thing happened, okay, it's the right time to do this.
Yep.
Yeah.
And it's a lot faster today because I wouldn't say that the people created the vaccine are less careful, but they as much as possible, not to say took shortcuts, but they've shortened a lot of
Red tapes.
Red tapes. Yeah,
Yep.
bureaucracy is one of the biggest problems when it comes to creating vaccines.
Yep.
So it's good that we're able to develop vaccines super quickly because this may be the first in our era, in our lifetime, but I'm sure I don't want to say it, but I'm touching wood again, it's not going to be the last.
Yep. I mean, new diseases always outbreak now and then. So at least from this, we know how we can be well prepared for the next one.
Yeah, it's not going to be the last because you know why? Animals are living closer together, and animals are living closer together with people. The risk of transmission is much higher. I guess this is a good wake-up call for us to be ready for the next one. Can you pay clinics to get the vaccine earlier? Can you pay hospitals or clinics to get the vaccine earlier?
Yeah, there's a lot of chatter lately in Malaysia because I think some people have seen like forms from shopping malls, from clinics. Oh, you
Letters.
right? You
Yeah.
can sign up and get the vaccine. You pay $100 and all that.
Yeah.
Well, the short answer right now is no, because right now most of the vaccines that's offered by the clinics are actually from the National Immunization Program. And how this whole thing started is because a lot of clinics they're actually appointed as a vaccination center. So they're like PPVs under the National Immunization Program. So when they sign up, they are the participating venues for it. So that doesn't mean you can just walk in and pay to get vaccinated. No, you must also get the registration done through MySejahtera, through the Vaccine Covid website, and also through like the typical way you sign up for the vaccine.
Yep.
And when you do get appointment, you might get the venue at the clinic. So you can go there and everything's done for free of charge. So whether to buy or not, that's coming up next. It's coming soon. So the government has already given a green light that state governments and private companies are allowed to buy the vaccine.
Yep.
But of course, the priority is that these supplies must be prioritized for the National Immunization Program, which is given for free. Yeah. So short answer, not yet. In the future, yes, it might be available. But the question is supply. Because like what Kari said, the priority should be given to the government orders.
In terms of like whether you can pay for the vaccine or not, like Alex says, when supply is much more than demand, and we feel that it's going to be happening like really soon, probably a couple of months, because again, registration rate has not gone up. And vaccination rate has gone up, right? So we're seeing like yesterday. So today is the 10th of June. Yesterday we saw 150,000 plus people.
Yeah, today as well. So means 2 days in a row.
Oh, okay. So it's been ramping up. I think KG is saying that they want to go 200,000
by July.
By July, and then
300,000 by August.
Prime Minister is saying he wants 300,000, right?
Yeah.
So hopefully we can hit that. because of the incoming supply. So we're getting a ramp up in terms of supplies coming into Malaysia. So once we hit, I think, closer to the 200,000 mark, there will be more supply than demand. And because everybody wants to go back to normalcy, and they want to start the economic sector in full force super quickly. Once there are more supplies than demand, then there will be an open market for the vaccination. Now the question after that is, okay, who's paying for the vaccination? If the government is already paying for the vaccines, why am I still paying it? Because the government money is my money. Taxpayers already paid for the vaccine. So should I pay for the vaccine if supply is available? I think there's some discussions on that. I'm not sure what has been finalized, but I think the consensus is that the vaccine is free.
Yep.
The administration costs to get the vaccine administered to you, that means the location. Let's say if it's a mall or if it's McDonald's or whatever.
Or like you own a factory, you want to get someone to come to the factory and inoculate everyone.
Get the doctor,
Yes.
get the doctor to come,
Yep.
including not just the doctor, but the facilities, the equipment, the
staff, support team.
the syringes, everything. You have to pay for that, and that is something you might have to pay for.
Yep.
The vaccine supply itself is free.
Yep. Under the National Immunization Program.
Yeah.
Yep.
So hope that clears the air on that. Okay, this is something that I think I'm even confused about. So what is efficacy rate? And does it mean that if a vaccine indicates that it has a low efficacy rate, that it is not as effective as something that has a higher efficacy rate?
I think the first thing to clear up is that efficacy rate is not the same as effectiveness in the real world. Because efficacy, the numbers is derived from the test results from phase 3. And you must remember that all vaccines are developed at different time. So like, for example, Pfizer, which is seen as the gold standard because it has an efficacy rate of 95%. But do bear in mind that this was done much earlier during the pandemic. So that's before the new war variants were around. So during that time, I think, no mistake, the cases wasn't that high as well. So it's more control. So the efficacy rate is much higher. And the later vaccines, like for example, China Sinovac, the efficacy rate varies from 50 to 70%, depending on the scenario. And one of the reasons why is because of the setup of the trial. Because who are you inviting to participate in the trial? Because not every case are the same. Like for example, Sinovac, in no mistake, they said that during the phase 3 trial, they involve a lot of healthcare workers, which are exposed to COVID-19 patients daily.
Yep.
So they're higher risk. So the efficacy rate basically means that, okay, how likely are you protected from COVID-19? But regardless of the efficacy rates, one thing's for sure for all vaccines is that they are effective in preventing hospitalization and death. And you notice that all these vaccines, right, they don't have a 100% efficacy rate. So that doesn't mean that you get Pfizer, you won't get COVID. You can get COVID. There's still a likelihood of you getting COVID.
Yep.
Even in Malaysia, during the phase 1 vaccine program, where it covers most of the healthcare workers, you got like 40 healthcare workers getting COVID. So that shows that you still need to be very careful. You still need to wear the mask, follow SOP, even to get vaccinated. But one thing's for sure, that all of them had mild symptoms. They don't need to be hospitalized.
Yep.
You won't take up any resources at the hospital. You don't need to go ICU. So that shows that vaccines are working.
Okay. What did I wanted to add? I think not much actually. I think you've answered pretty much everything. In terms of efficacy, being protected is better than not being protected at all. So having some vaccine, whether it's 50% efficacy or 90% efficacy, is better than having no vaccine at all. So and it doesn't mean that if you get like Pfizer is better than
Sinovac or Astra.
Yeah. Like Alex explained, is what's better is for you to get a vaccine. So if you've been called up to go and get a vaccine, don't go there and ask, is this what? Can I choose this? Can you choose that? Just go and get it. Okay, so there's this thing called ivermectin.
Yes.
What's that?
So a lot of people are saying that ivermectin is like the wonder drug. This the solution that can cure COVID-19. A lot of anti-vaxxers are saying about that. Like, why bother with vaccination with ivermectin?
Yeah. Okay.
The thing is, ivermectin, as clarified by the Health Director General, Dr. Noor Hisham, is only licensed to be used on animals and is usually used to treat parasitic infestation. There are talks of using it for COVID-19 cases, but until now, there isn't enough data to support that this can be used to cure COVID-19. And it's not authorized to use in Malaysia It's also not authorized to use by the US FDA and even the European Medicine Agency. And even the FDA published an article on why you should not use ivermectin to treat or prevent COVID-19 vaccine.
Okay, what is the top 3 reasons why you shouldn't use ivermectin?
There's a lot because I think
Number one, it's for animals.
It's for animals, and it's also to treat like specific parasitic infection. And if you take the wrong dose, you can die. It's dangerous. But Malaysia has not completely ruled out yet, so they're going to do a trial
on ivermectin
in Malaysia.
Wow.
Ivermectin to because a lot of countries they've done the trials and they've seen that there's no significant improvement. It doesn't show that it can cure.
It's not a cure lah.
It's more like treat the symptoms.
Okay.
Yeah. It's not definitive that this is actually effective, but Malaysia going to try anyway on selected patients. Maybe people with stage 4, stage 5. But they want to try on 500 people at government hospitals. And hopefully this will give like a clearer picture on its effectiveness in Malaysia. So at least when people say again, hey, why don't you try ivermectin? The MOH will say, see, we've tried on 500 people, it doesn't work.
Yes.
If it works, maybe we can expand this to another larger trial sample.
Even if it works, you cannot apply the general rule to everybody. So like you said, maybe it works for people who are like
certain symptoms,
who have certain symptoms, who have certain conditions, who are at a certain age, or who are already at a certain stage of COVID-19. You know, some people have to be intubated, some people have to be on ventilators. Maybe because it's so critical there that okay, let's just try anything to save this life. So it could be that. It could be not the wonder drug, but it could be the last resort drug. And those are two different things.
Yep.
You know, the last resort drug is like, okay, let's try to save this person's life with, I don't say, lesser regard to what the side effects are. And it could be adverse, you know?
Yeah. Prevention is better than cure. You get a vaccine to prevent yourself from getting COVID. If you do, but the thing is, this ivermectin, right, it's not tested on human. It's not tested. It's not proven to be safe, not approved for human use just yet. So if it was me, go for the vaccine. That's proven and tested.
Okay, here's a question. Would you eat cat food? You wouldn't, right? I mean, you can.
It's meant for animals.
Yeah.
Yeah.
I wouldn't.
Yeah.
I mean, would you eat dog food?
Nope.
No, man, it stinks. So why would you use medicine that's for animals?
Yeah. So don't go out and buy off the shelf or whatsoever.
I don't
Stay
think
away.
you can. Because it's for animals. Maybe you can.
Maybe you can, but that's why the health ministry, they warn people, don't take ivermectin. It's not meant for humans at the moment.
You know, I'm not a doctor, but you know, I
common
feel like
sense, right?
Yeah, common sense is one thing, but okay, what I want to say is I think I trust the KKM people more than I trust myself lah.
Yeah,
if they say don't take it, then I won't take it lah.
Yeah, it's not just KKM, the FDA, the EMA, they all said it's not meant for COVID-19. It's not authorized yet.
Okay, so our last kind of theory debunking thing about COVID-19 before we end the show is I'm pregnant, not on me, sorry. If I'm the question is if I'm pregnant, what vaccine is safe for me?
Okay, so the JKJV, which is basically the Special Committee of Ensuring the COVID-19 Vaccine Access, they have actually issued a guideline on what vaccines you can take if you're pregnant or breastfeeding. So if you're pregnant between 14 to 33 weeks, the recommendation is Pfizer.
Okay.
So only Pfizer for now. So if you sign up for AstraZeneca, sorry, you can't take it because you're pregnant. But if you're breastfeeding, they recommend Pfizer and AstraZeneca. So these two if you're breastfeeding. And if you're pregnant or breastfeeding, you can actually declare it in your MySejahtera app. So actually go update status. You can say you're breastfeeding or pregnant. And can say when you're expecting to give birth. So once the data is there, then they will know which vaccine is suitable for you. So on regards on other vaccines, so it doesn't mean other vaccines are dangerous. No, it's just that the reason why they don't recommend them is because there's not enough data yet to support the use for pregnant or breastfeeding women.
Yep.
Eventually, when there's more data, then these things might change.
What if I'm pregnant? What's this? I'm not 14 weeks pregnant, but I'm like 12 weeks pregnant or 10 weeks pregnant.
Good question.
Okay, I think if you are below the 14 weeks threshold, as with any pregnancy, especially for first time mothers, the first trimester, which is the first 3 months, which is about 14 weeks, is very crucial. Because you want to protect the baby first and let the baby develop properly, become safer. So generally, after the first trimester, things are generally smooth sailing from there. So if you are pregnant from 0 to 14 weeks, before 14 weeks, I think
Stay away
you have
first.
to stay away from all this. Even you have to stay away from medicines. Best if you check with your gynecologist,
Yep.
to check with your doctor whether it's suitable or not. But the guideline says 14 weeks and above.
Yeah. So if you do get appointment, please call and reschedule and let them know that you're pregnant.
Yeah. Okay. So anything else you want to add, Alex?
What else? I think another common. I need to bring this up again. There's always concern about blood clots and AstraZeneca. Yeah, I think we've said this many times before. The thing is, at the end of the day, the benefits far outweigh the risk.
Yes.
There is risk of blood clots, but it's very, very small. And just recap, based on a study by the European Medicine Agency, they conclude that the risk of blood clot is 1 out of 1 million. Sorry, 1 out of 100,000. And we look, it also varies depending on age groups. Some say that AstraZeneca is actually dangerous for older people. It's not. It's actually safer for older people. Because based on data, the risk of blood clots is actually very low for older people. Like for those aged 80 and above, the risk is 4 in 1 million.
Okay.
Just like 0.0004%. And in fact, the highest risk
Is COVID?
COVID is actually higher. The risk of getting blood clot is actually higher if you take birth control pills or if you smoke. If you're smokers, your risk of blood clot is much, much higher.
Oh shit.
Yeah. And what I want to bring up is this research by the University of Edinburgh that tracked 5.4 million people in Scotland, and they found that there's only one additional case of thrombocytopenic, basically like a case of a low platelet.
Idiopathic thrombocytopenic purpura.
Yeah, or ITP. So they found that it's only increased by 1 out of 100,000 people. So that shows it's very rare. And even if you get this condition, it has not caused any deaths based on the study. And this is treatable.
Yeah.
Yeah.
And it's treatable. When I had my vaccine, you treat blood clots just like any normal way. So if it's affecting your hands or legs, you feel numb, straight we go to the doctor. If it's like really, really numb, it doesn't feel right, straight we go to the doctor. If it's gonna attack like near your heart, if the blood clot is gonna be in your cause you a heart attack, you'll be able to feel some numbness in your hands, pain in your hands on the left side. Just be ready for that, right? If it's gonna be a stroke, if the blood clot is gonna be in your brain, you're gonna be sweaty, you're gonna feel feverish, you're gonna your face is gonna droop from on one side, and a lot of people who've never experienced this feel that this is going to happen instantaneously. Actually, no. For me, I've dealt with a number of people that have had strokes. Strokes happen gradually. You do feel weird at the start of the day, or you do feel weird at the onset of stroke. And a lot of people, the stroke can be treated if they act quickly. So within like maybe the 10, 15 minutes, within half an hour of these weird things happening to your body, your face drooping, you're sweaty for no reason, you start puking, immediately call an ambulance and go to a hospital. They'll be able to issue you a blood thinner. There are treatments for that, and you should be fine. So touch wood. So that what I wanted to say is it's treatable.
Yeah. And so like for any vaccination, there are side effects for the first 1 or 2 days.
Yep.
But beyond that, if you get any severe side effects, please go seek medical treatment immediately.
mRNA will alter your DNA and is loaded with poison.
And 5G chips. That's what the so-called say. I mean, a lot of conspiracy theories say that mRNA can alter your DNA and stuff like that, and it has a long-term effects. But that's not true, because the mRNA vaccine, basically what it does is it just holds a code to tell your body to produce a specific protein, and this protein will be used like a target practice, so that your body will fight, will recognize it, and will attack it when they see the real thing. So basically just to train your immune system. So that's all it does is to carry a code to produce a spike protein. You not alter your DNA whatsoever.
I'm not sure of anything that can alter your DNA that you can ingest. Maybe radioactive stuff.
Possibly, if you put yourself in a microwave.
You'll be fried first.
Yeah.
That will definitely alter your DNA.
Yeah, so it's not true that, these vaccines will alter DNA. It's not true that, Bill Gates will control your mind, put 5G chips in it. The thing is, if people want to track you, right, just do it in your phone.
But I do notice that when I took my vaccination, right, Wi-Fi coverage been good for me everywhere I go.
I think you update the firmware in your router.
Okay. Is it true that even without the vaccination, the recovery rate is almost 100%?
Well, more than 3 million people have died. I mean, okay, if you look at the numbers, right, it sounds like, oh yeah, the recovery rate is high. But yeah, it's true, it's high. But the thing is, those who recovered, there's something called long COVID. There's actually long-term symptoms that comes with it. And you don't get COVID at all. And some people are saying, oh, I have a strong immune system. I'm okay, I can fight with it. The thing is, yeah, you might be able to survive COVID. But think about this. You could be spreading this to other people who are vulnerable.
Yeah.
Like, for example, if you can survive COVID, but you stay with your old parents or grandparents, you could potentially infect them and they could suffer the worst outcomes and they could die. So it's not just about yourself, but it's about people around you and the community as well.
So even if the recovery rate is 99.5%, you have to look at the bigger number, right? So,
And also, think about it.
and the long COVID stuff.
Yeah, like right now in Malaysia, we have more than 80,000 active people in hospitals. 900 people are in ICU.
Yep.
So so you can say, yeah, they can recover, but all of them are taking out resources at the hospitals. And imagine this, if let's say ICUs are full, like what Amin said previously, if you get in a car crash, you need to go to ICU.
Yes.
There's no space for you.
The doctor has to choose whether they want to take you or whether they take you in, let go of one bed that's treating a COVID patient, or to let you in. So the doctor has to decide. The doctor is now playing God. You live or you live. So that's what it means by taxing the healthcare system. Now this is the last one. Okay, so during the 1918 Spanish flu, only the vaccinated died. Is that true, Alex?
That's a complete hoax. And the fact is there are no vaccines during the 1918 pandemic at that time. And the CDC has said that during that time they estimated that 500 million people were infected and about 50 million people have died. And how they overcome that flu is through other conventions. So the flu was actually controlled through non-pharmaceutical interventions, which includes isolation, quarantine, good hygiene, use of disinfectants, and limitation of public gathering. So no vaccines were involved, and you can see how drastic that caused.
50 million people. No vaccines means it's not that they couldn't develop a vaccine in time. The technology wasn't available. They didn't
understand.
They don't know that, okay, we could make vaccines. They didn't know that.
And they don't have much data on how they spread. Some people say, is it in the air? Is it in the floor? Or whatever. There's not much information about the flu.
Yeah, so imagine the nurses and doctors at that time and how crazy things were. So imagine like how many hoaxes and weird stuff and voodoo crap that's been pushed around during that period.
Yep.
And it's funny that even after, so it's 1918, I don't know how many 100 years ago.
100
that
years,
was like 113 years ago, 103 years ago.
Yep.
Over 100 years ago, people were spreading rumors and whatever. Today, even with the advent of technology and smartphones and podcasts like us, people are still spreading rumors.
You can have smart devices, but it doesn't make you smart.
Yeah. Okay, on that note, we're ending the show. So I just want to remind everybody we're available on podcast as well. I know today's show is a bit long, but I hope you find it useful. We are available on podcast. Just search for Search Engine Let's Talk About on any and all of your favorite podcast platforms, and we're there. If you're listening to us on podcast, please do, if you have it in your heart, give us a 5-star rating, because that helps us a lot. That helps the show a lot. A lot more people will find the show if we get good reviews. And if you're watching us on YouTube, as always, please do drop your comments, questions, suggestions, because that helps us make more shows. That helps us to think of what shows to talk about in the next episode. If you like the show, please do give us a thumbs up. And if you haven't already, please do subscribe to our channel. Hopefully you like all the other contents that we have there as well. And that's pretty much it, everybody. This is me, Amin.
And this is Alex.
Catch you guys later.
Bye.